Hello, my name is David Urbach, and I'm the Chief of the Department of Surgery at Women's College Hospital in Toronto. Today I'm going to talk about my article published in Healthcare Management Forum entitled Improving Access to Health Services in Canada. The 2017 Commonwealth Fund report found that in comparison with other countries' healthcare systems, Canada doesn't perform very well in delivering value in healthcare. Certainly not as well as we all would hope. And one of the areas in which Canada performs relatively poorly compared to other countries is in the area of access to health services. The particular area of access where we fall short the most is in timeliness of health services. And these are things like long waits before people can have elective surgical procedures like cataract surgery or joint replacement, and also long waits for a visit with a surgical specialist or long waits in emergency departments. The first potential solution is in the area of public expectations. A lot of the provinces now have wait time reporting websites, so there's a lot of publicly available information on wait times, particularly for elective surgery. There are also standard waiting times that are felt to be acceptable to wait for certain types of health services. The problem with just reporting wait times is it really doesn't do anything to improve wait times, but it does provide information to providers and to hospitals so we can see how we're doing and to see if any of the strategies we put in place are actually making a difference to improve care. The second area that we can improve access is through reducing unnecessary or potentially harmful care. And we see this in a variety of areas where people are getting a lot of services that may not be absolutely necessary. In studies that look at people in Canada who have cataract surgery, for example, not everybody has such poor eyesight that they might actually benefit from cataract surgery. So if you have surgical procedures for which people are waiting a long time, it certainly makes sense to make sure that we're not doing unnecessary procedures on people who don't really need them. The same is true for things like joint replacement or for back surgery, where a lot of people in the queue to have these surgical procedures may not have a disease that's so severe that they actually need to have surgery right away. So we have some programs that use triage by physiotherapists, for example, to assess patients early on to see if they're actually candidates for surgery. And by taking people out of the queue for surgery because they're really too healthy to have surgery at the present time, then it allows more people who really need to have treatment to be able to get access to more timely surgery. The third suggestion for improving access is through single entry models. So what single entry models are is a way of coordinating surgical care so that a family doctor, for example, doesn't have to identify a specific surgeon to refer their patient to and hope that that surgeon has a short wait time and the patient will be seen quickly, because really family doctors don't really know what the wait times are for all the specialists and all the surgeons. What a single entry model does is it brings all the new referrals through a central intake, so they all go into the same pool, and then patients join the same queue and eventually see the next available provider, the next available surgeon. So these models are very common in other industries, such as when you go to a bank. These days you don't have to choose a teller right from when you walk through the door of the bank and choose what seems to be the shortest line. You join a single line, and when you get to the very end of the line, you just see the next available teller. And what that does is, on average, is it reduces the wait times for everybody. And we can apply these types of models into healthcare so that people waiting for elective surgery are also waiting in a single queue so they see the next available provider. A fourth recommendation we have in the paper is through greater use of ambulatory surgery. So we know that one of the biggest impediments and sources of gridlock in Canadian hospitals is the lack of free hospital beds for people to use when they're recovering from a surgical procedure. So often we have a situation where a hospital's full, there's no beds available, and someone who's scheduled for surgery can't have that elective surgery because there's no bed to go to. We found through greater use of ambulatory surgery, and that means being able to discharge patients home on the day of surgery as opposed to admitting them overnight in a hospital, that allows us to conserve hospital beds, and even if there's no free beds available in a hospital, we're still able to perform more surgical procedures. And obviously this helps us keep up the surgical volume so you don't end up with backlogs and prolonged waits for people who are waiting to have similar surgical procedures. The final area where we think there's room for improvement in enhancing access in Canada is by changing the ways in which hospitals are paid to deliver surgical services. So historically, Canadian hospitals are funded under global budgets, so they operate every year with a certain amount of money and to try to provide as much healthcare services as they can. The problem is, when hospitals are strapped and budgets are very close, there's a lot of incentives for hospitals to reduce the amount of elective care that they provide because people will still need to have emergency care. By changing the model of funding hospitals from global budgets towards something called activity-based funding, where hospitals are basically paid for each additional service that they do, there now becomes an incentive for hospitals to provide a lot more elective surgery. So activity-based funding models such as Ontario's quality-based procedures program, hospitals are generally paid a certain amount of money for each additional patient who has something like a total joint replacement, so that hospitals now have an incentive to provide lots of surgical services, and by doing that they can get through a backlog and make sure that they provide enough resources so that people can have the elective surgery that they need instead of running up longer wait times. The truth is, access to health services is a problem in every health system, and fundamentally that's because healthcare in the modern world is very expensive, and it's more expensive in general than people are willing to pay for, whether it's through out-of-pocket payments or through taxation or insurance premiums. So every health system has to grapple with this problem that people demand more health services than the system can really bear at any point in time. And different countries handle problems with access in different ways. In Canada, clearly the problem comes to the surface in the form of long wait times for things like elective surgery and for diagnostic imaging. Ultimately, how we're able to adapt to demands to improve access to healthcare and to reduce wait times will really determine how sustainable the healthcare system is in Canada, because ultimately public confidence in the system is important for sustainability. So what we have to demonstrate is that not only we're aware of the problems in access, but that we're actually doing something about it in a way that's going to make wait time shorter, improve access, and make the system function well and sustainably for future generations.